If a patient walks up to you, confused about their medications, nervous about a diagnosis, or just not listening, what do you say? Patient counseling and communication shows up throughout the PEBC Evaluating Exam, and it's one of those areas where small technique mistakes cost you big marks. In the next few minutes, I'm going to break down the core frameworks, the traps candidates fall into, and give you practical tools you can actually use on exam day. Let's get into it. Here's the thing. The evaluating exam isn't just testing whether you know drug names and doses. It's testing whether you can actually translate that knowledge into a real patient conversation. Under the current blueprint, communication is woven into scenarios across multiple competency areas, and the addition of health equity content means you need to think about how factors like language, culture, and access shape how patients receive information. So strong counseling technique isn't a soft skill anymore. It's a testable, scorable competency you need to own. One framework that works really well as a mental scaffold is gather. Greet, set the tone, make the patient feel safe. Ask, find out what they already know, what concerns they have, what barriers might exist. Tell, give them the essential information without overwhelming them. Help, check for understanding and address obstacles. Explain the follow-up plan clearly, and return or refer when the situation is beyond your scope. On the exam, when a counseling scenario feels overwhelming, mentally running through gather helps you structure your thinking so you don't miss a step. This one is huge. The teach-back method is the gold standard for confirming patient understanding, and exam scenarios love to test whether candidates actually close the counseling loop. The mistake most people make is asking, "Do you understand?" which almost always gets a yes, even when the patient is completely lost. Instead, you want to ask them to demonstrate or explain back in their own words. Can you walk me through how you'll take this medication at home? That shift from passive confirmation to active demonstration is what separates adequate counseling from excellent counseling. Watch for answer choices that reflect this distinction. Motivational interviewing, or MI, comes up in scenarios involving lifestyle counseling, adherence issues, or patients who just aren't ready to change. The core tool is ORs, open-ended questions, affirmations, reflective listening, and summaries. The key principle is that you don't push or lecture. You reflect back what the patient is saying, you affirm their autonomy, and you help them find their own reasons to change. On the exam, if a scenario gives you a patient who's resistant or ambivalent, the right answer almost never involves telling them what they have to do. It's about exploring their perspective and supporting self-efficacy. Health literacy is a critical piece under the current blueprint, especially with health equity now explicitly in scope. A huge portion of patients have limited health literacy, meaning clinical jargon, complex instructions, or dense written materials create real barriers to safe medication use. On the exam, if you're choosing between an answer that uses technical language and one that uses plain language wins almost every time. And health equity goes a step further. It asks you to think about systemic barriers like language access, socioeconomic status, and cultural context that affect whether a patient can actually act on your counseling. Think beyond the counter. Non-adherence scenarios are some of the most common in counseling-type questions, and they're tricky because the right answer depends on identifying the root cause before jumping to solutions. A patient who skips doses because of side effects needs a very different response than one who can't afford the medication or one who simply forgot. The wrong approach, and a very tempting wrong answer, is to immediately educate or lecture. The right approach is to ask a non-judgmental, open-ended question first, listen to the answer, and then tailor your response. Always diagnose the barrier before you prescribe the solution. Exam scenarios love to test whether you can adapt your communication style to specific patient populations. With pediatric patients, remember, you're often counseling the caregiver, but you should still involve the child in age-appropriate ways. With older adults, slow down, check for hearing difficulties, assess cognitive load, and be mindful of complex regimens. When there's a language barrier, the evidence strongly supports using a professional interpreter rather than relying on a family member, because family interpreters can inadvertently filter or soften critical information. And cultural humility, asking rather than assuming about a patient's values or practices, is always the safer approach. Let me leave you with the 3 mistakes I see most often in counseling questions. First, jumping straight to education without first exploring what the patient already knows or believes. Assess before you address. Second, closing a counseling interaction with "Do you have any questions?" instead of using "teach back." Weak close, weak marks. Third, and this is the big one, picking the answer that gives the most clinical information instead of the one that's most patient-centered. The exam is testing communication judgment, not just knowledge. If one answer lectures and another listens and collaborates, the collaborative one is almost always right. Keep that filter on for every counseling question you see. You've just covered the core of what you need to know for patient counseling and communication on the PEBC Evaluating Exam, but there's a lot more depth to drill. We've put together a detailed study guide and question bank that goes much deeper on this exact topic, with worked scenarios and answer explanations. You can find it in our Etsy shop. The link is in the description and pinned in the comments. If you have questions about anything we covered today, drop them in the comments below. I read everything and I'll reply. And if you want to catch new topic breakdowns as soon as they go up, hit subscribe so you don't miss them. Good luck with your prep. You've got this. If this helped, check out these other PEBCBuddy videos to keep your prep going.